expert in KMC neonatal nutrition and also deliverer of PMG. Dr. Ram, can I have slide for Dr. Priyanka? And gold medal in pharmacology also. So with this, I would like to invite Dr. Purva Goria to deliver it.
Debate, and it is on the recent increase in PG seats. Is it expanding access or is it diluting the quality? So I'll be speaking for the motion, which I'll be speaking like yes, recent increase in PG seats is actually expanding access and we are not diluting the quality. So let us go. So why we are increasing the PG seats? Why they are being increased? Let us see some of the things and begin the debate. We'll begin the debate and hope it will not progress to this. Sir, okay. So this is the status of PG seats. I have taken it since 2000s because like most of us are from the 2000s, 2001, 4, 5. So this data of 2000s is an approximate data because there were there was no internet at that time, so flourishing, all those things were not happening. The government was also not putting data on internet. So this is an approximate data which says that there was an all India seats of 15,000 with MP having only 260 seats. PG seats were increased in 2015, they were around 31,185 seats and MP had 746 seats, and this recent data is of MP of 2025 which has just released in 31st October after the NMC has started, after the PG counselling has started, and it has now become 52,173 seats with MP having 1,929 seats. So this is what is the scenario where we are saying that the PG seats have increased. This is the number of seats which we are having. Let us go to the MBBS. Okay, how many MBBS we are producing? So India is the leading country who is producing around 1.3 lakhs of MBBS graduates per year. So where are they going? Let us see what is the future of these MBBS students. What is the future? What do we think? What will these 1.3 lakhs will go and do in the community and commercially saying what will they do in the market? So every undergraduate will aspire to become a specialist. We all know this, and everyone who is sitting here in the back, also the PGs who are sitting, they always aspire to become a specialist. Nobody wants to be an MBBS, and everybody should think जो MBBS नहीं भी हैं, जो non-professional courses भी हैं, क्या वो आजकल अंडर ग्रेजुएशन से हो जाए? Our MBBS will do a post graduation, and there is a deficiency of specialists in India, which I'll be telling you with the figures. India report, which is being published in September 2024, but it has the data from 2022 to 2023, which has showed that there is a deficiency of 4,413 specialist doctors. They are only working against the need of 21,964. So there is a shortfall of 17,551 specialists. That becomes almost 80%. So only 20% of specialists are working in our CHCs and PHCs. How many rural CHCs we have? This is the data. India has around 5,491 rural CHCs. After 2014, there has been an upgradation of PHCs to CHCs. I think each one of us knows that PHC doesn't require specialists, it's the CHC which requires specialists. So the PHCs have been told that there is a shortfall in CHCs. The previous one was about all the total specialists, but there is a deficiency of 80.5% of specialists, pediatricians. So, and there is an overall deficiency of 67.1% of pediatricians in total rural CHCs and urban CHCs. We were just talking in so many other talks. There was a debate also which said yes, there is a faculty shortage. From where are we going to get the faculty who will teach the MBBS students? These PGs will become assistant professors and they only will teach the students. So there is a faculty deficiency also which has to be fulfilled. And yesterday we talked that there is lots of online things happening. There is lots of AI which has come. The teacher has become an AI. Co-teacher is an AI because we don't have teachers. From where we are getting the teachers? These are the these PGs. If we increase the seats, there will be more PGs. They will be more inclined towards academics, and then we will get the medical teachers. So how are we going to fulfill the deficiency? This was the deficiency. Now how are we going to fulfill it? Yes, the answer to this question is largely by increasing the PG seats, and that is what being done. We need specialists, we need medical teachers, so we have to create them. Every MBBS student aspires to become a specialist. They just don't want to be an MBBS. And yesterday also we have talked that MBBS has lost its value. The MBBS is the simple MBBS, plain MBBS बोलते हैं आजकल. वो क्या है? वो plain MBBS है. Why? Because there is nothing in there has been learned by that MBBS undergraduate. So we need a specialist. We need specialists. In the past years, due to limited number of PG seats, many graduates left the country to pursue specialization abroad. Many of us know, हमारे खुद के batchmates, selection नहीं हुआ pre-PG में, they left the countries, they have gone abroad and they are working over there. Or they have changed the stream also. Many of my batchmates, they have taken MBA कर लिया हम लोगों ने, कोई UPSC करके कोई पुलिस में चला गया. So what has been done? हमने MBBS बनाए इतने सारे और हमारे यहाँ से डॉक्टर्स चले गए. And we are still facing the deficiency of doctors. So study reported almost 56% of MBBS graduates left country to pursue post-graduation abroad in 2010. This was a study done in 2010. There are recent studies, but this data is of 2010 because at that time there were very less PG seats. And this attrition has really caused a major deficiency of doctors. Now, one thing again has come. There is a recent doctor-patient ratio in India. It has been said that it is 1:811. That is 811. And which is better than the WHO standards of 1:1000. Okay? So, let us see the map of India. वो क्या कहता है? This is the map of India which is showing the number of the doctor-patient ratio. See what is the doctor-patient ratio of Madhya Pradesh? It is 1:15,000. 1500, sorry. So, it is not good. It is not as good as the total India's doctor-patient ratio. But when you go down to the south, the doctor-patient ratio is better. It is almost 1:499, 488, 457, 495. So why is this there? Because there are lots of PG seats over there. And there are lots of specialists which are being formed. Also, this doctor-patient ratio doesn't only have the specialist, it has everybody. It has the Ayush doctors, it has all those who are practicing homeopathy, who are practicing Ayurvedic, everybody has been put into this doctor-patient ratio, which are being like portrayed as doctors and how many specialists. But yes, you can see Uttar Pradesh. Uttar Pradesh also has 1:2363 ratio. It is double, triple to what is needed. So we still have lots of a far way to go. Increase in PG seats, what will happen? We'll have more PGs in India. They will stay here. They will not go. Less brain drain. Doctors will be here only. better doctor-patient ratio, proper doctor-patient ratio. More specialists, quality care. We are saying the quality is being diluted. But if we have more specialists, is it going to decrease the quality or it is going to increase the quality? So if we have specialists, it is definitely going to improve the quality of care at all levels. So yes, more specialists are definitely going to increase the quality of care. And again, the quality check has been done at the point where the PG seats are given to a particular medical college or an institute. It has been seen, the number of faculty is seen, the infrastructure is seen, and everything is seen, then only the number of PG seats is given to them. And we all know that pediatrics is still a sought after branch after MBBS. Still pediatrics is there at number 4, 5. First and second we know is obviously radiology and dermatology, but still pediatrics is a sought after branch. And all those undergraduates who aspire to become pediatricians, they are just left to do something else if we do not increase the PG seats. They will do some other specialty where they will not be happy. And in the previous panel discussion, there was a talk about resilience during residency. एक resilience का ये भी एक कारण नहीं है resilience, उसका ये भी एक बड़ा उनको करनी ही नहीं थी वो residency and they are there. Why? उनको क्यों नहीं मिली वो residency? Because they did not have the seats. There were not enough seats. So let us help our undergraduates choose their own desired branch and become a happy doctor. And we need pediatricians. Why we need pediatricians? We need them to decrease the NMR and IMR, which is so high. It is so high. MP has the highest NMR and IMR. So MP definitely needs lots of pediatrician, and so there is definitely a need of increase in the PG seats. So we should not let anybody think that I gave up my life to learn how to save your life. They should be given their own lives. They should be given their choice to pursue whatever they want to do. And by increasing the PG seats, we can definitely help them pursue the dream branch. Nowadays they say dream branch. मेरी dream branch ये है. So let them have their dream branch and have their own life and save others' life too. Thank you.
Very well. Dr. Purva, now I would like to invite Dr. Priya.
So, let us first ask this question. Let us take a pause and just ask this question to yourself. Do we want more competent professionals? Like ma'am said, MP need more doctors. Definitely, every state needs more doctors. But do we need more competent professionals or more number of degrees and certificates? We need more certificates? More number of competent professionals. Okay, so we have that answer at the beginning itself. So, I start with this quote that quantity without quality is actually illusionary, and this unplanned expansion has no problem, but this unplanned expansion is harming the students, the patients, as well as the credibility of our profession in the society as well as globally alike. Right now we are losing the credibility at the global level also. We all know that, and there is no point I think in debating about it. And the large rise in numbers, we feel that it's a achievement, this great leap of numbers. This is looking very fancy in terms of media reports and for the politicians, and we also feel that our college achieved 2 more PG seats. Like we had 3 PG seats earlier, but now we say we have got 5 PG seats. This looks an achievement to me also as a faculty to boast in front of anybody, but actually is it a leap or it's a gamble? Because these are just hollow outcomes. This is my belief. We may decide after some more slides. So Modi ji has a very noble intention. He announced last year that they will be adding 75,000 more UG and PG seats over next 5 years. Intention is definitely noble because every district needs good number of doctors, and obviously PGs because we have to decrease mortality at all age, especially infant and the neonatal mortality. But since my MBBS days, I'm a 98 batch, I have been learning that WHO has advised this 1:1000 ratio. I think everybody knows about this number, but do we know that there was no such number ever quoted by WHO? This number was actually a myth. So WHO actually said that workforce must reflect each country's epidemiology, demographics, health system structure, and one size doesn't fit all. WHO has never recommended or documented this universal this doctor population ratio, and how this number actually came out in our textbook and our teaching. So there was a 2004 WHO supported report which said that those countries which have more than 2.5 thousand healthcare workers, which include doctors plus nurses plus midwives per thousand population, they have better healthcare outcomes. And this was quoted in a 2011 high level expert group India's report, which is then quoted in every report that the target of this 1:1000 was given successively. So this was not a target, it was not a standard actually. This was a goal to be achieved over the years. And then this magic number is being used for increasing the UG/PG seats every year. So, and ma'am has ordered this 1:834 population. So what's the problem with being Ayush doctors? We are including them also. Because we also know what quality of MBBS doctors we are producing. But, and ma'am has also depicted that beautiful India's chart where she has told the distribution of these doctors in different states and community. We also know that this 70% of the doctors are actually placed in the urban areas, and rural population is, the ratio is even up to the, as poor as 1:10,000. So is the problem maldistribution, or is it the problem with the numbers? So it is something like, I'll speak in Hindi, it's something like we are having some nails between our fingers and we are trying to hit the nail, but we are actually hitting our fingers. So we are actually not hitting at the right problem. So we need the placement of the doctors at right places by giving them more opportunities and making those places more comfortable and more opportunistic to those doctors, so that they don't go abroad and they don't search for the opportunities as a postgraduate. So the biggest gaps are in the primary care and in the family medicine, not in the specialities or super specialities. But the number of seats which are being added in last few years are in the postgraduates, the specialities, broad specialities and super specialities. So do we need more number of cardiologists and neonatologists, or we need more number of family physicians? We can offer more number of PG seats in family medicine also, rather than giving more number of seats in cardiology or so this emergency medicine, family medicine, general this thing is more required. So we should know that even the family medicine PG seats are less than 2% of the total seats, which is something very strange. As a faculty, we always talk about the roles of the students, but there are many roles of the faculty also. She has to be a information provider, resource developer, planner, assessor, facilitator, and also to behave as a role model all the time. But Indian public health standard says that for every 10 beds there should be one specialist and one resident. But what the minimum standard requirement of the NMC says? It says that for one unit, one professor, one associate, and 180 for unit 1, and for next unit only the 2 faculty and 1 resident is enough. Then who will cover the night duties, who will cover the NICU, PICU, OPD, and if somebody goes on leave, who will take care of that leave reserve? So, I mean, medical college, which is expected to not only run the hospital but also to provide the supervision and training, they are rather working below the Indian public health standards. So, teaching institutions are legally compliant, but they are functionally understaffed. So we are creating the foundation which is weaker than even the service hospitals. Compliance with minimum standard requirement is not at all equal to assurance of quality. Management proudly claim that we are now compliant with the minimum standard requirement, but we have already understood this, that they are not equal to optimal staffing. And by hiring just enough to pass inspection, what is happening? Faculty is overburdened. We all know this actually. We are overburdened with ward, ICU, teaching, research. Like this, in the previous talk, they said we have to give structured feedback. Who has the time to give structured feedback? We have to go to OPD, then we have to run to the ward, we have to go to ICU, then we have to do documentation, keeping the attendance record, submitting so many documents to the administration, arranging the inspections, audits, so many things. So then the bedside teaching is happening in a hurried way, compromised supervision, and that is why the residents are not satisfied, and that is why they are not competent also. And now the reality check. Even with these MSRs, almost 50% colleges were giving show cause notices last year for being short in faculty. In Maharashtra, none of the colleges having complete number of faculty. This is the newspaper clippings. This is this document is marked as confidential, but I don't know how come this is available on internet. This is a study supported by funding from Niti Aayog. It says that almost there is in total faculty all over the country, almost 30%, like shortage of 30% faculty. We need almost 1,28,000 faculty across all medical colleges, and we have only 96,000 faculty. So if the study from Niti Aayog says, and it includes 12 government medical colleges, now imagine what is happening in the private colleges and new colleges. Colleges like Maulana Azad Medical College, SMS Jaipur, and this PGIMS Rohtak and Agra, they are also included in this study. Now, so what we are doing is we are building a skyscraper of the PG seats on a cracked foundation, and when every year some new PG seats are added, the cracks actually multiplies. And now we must have seen this document now. The last month NMC has even lowered down the bar of what are the criteria to be the faculty in a medical college. So if the faculty, anybody can become the faculty without any basic training, without any basic much experience. So some more things to add on, like infrastructure is also compromised. Even the training environment is compromised. And now coming to the evaluation part. Assessment is also not standardized. Most of the time the examiners are under pressure because every new batches are added, so we have to actually pass them, otherwise next year new batch will be added. So this is leading to credential inflation, many degrees but not competence. When the denominator of seat grows without the numerator of quality, the section will definitely fall down. Now what the PG's residents themselves say, those who are appearing in the NEET exam. Last year, every year we know almost 20,000 seats remain vacant after the 2 rounds. And last year and the last year also they reduced the NEET, the minimum requirement percentile to 0. Why it happened? Because most of the seats were lying vacant. Why they were lying vacant? Students themselves say that the most of the vacant seats are in the private medical college or in the non-clinical or paraclinical branches. So that means they don't want to join those branches, or they are not able to afford those private college seats. So who is actually getting benefited from this rise in seats? So most of these seats either will remain vacant even after that because students are not going to join those kind of branches, or they are not able to afford it. That means it is not a universal access. So when the seats become a commodity, obviously it is not. So education will become an investment and patient will return. So it is going to be a very difficult situation after a few years for our country. Resident surveys, all resident surveys which have been done in our country have said that students are not satisfied with the kind of supervision they are given in the bedside rounds. They are not being provided adequate thesis supervision. Only 13% students get thesis support. And this is a very small survey of 274 students. Imagine if we do the survey of all colleges, all students, what data we are going to get. And we all know what is happening in our individual colleges. They are not satisfied. Even the same Niti Aayog data, students are not satisfied in those 12 government medical colleges also. So who is happy with this explosion? Students. Initially they are happy because more seats, more chances of PG entry, but sooner or later they are going to be unhappy because they will end up into the ill-equipped medical colleges, poor supervision, overwork and low quality of training. Faculty members, they are definitely unhappy because they are overburdened. Same staff is managing ICU, OPD, or NICU, teaching, admin duties and everything. And there is no time for mentorship and research. Quality is definitely getting diluted. Administrators, they are very happy because more PG seats, it's a matter of prestige, revenue, political goodwill. They are running institution-ready setups, faculties borrowed, infrastructure stretch, short-term benefit. But in the long run, definitely there is going to be credibility lost to them. Politicians, they are extremely happy. We create 1,000 number of more seats. Like this, with J.P. Nadaji also, like even in the AIMS convocation, he said about this rise in seats. So yeah, they are flaunting this rise in seats even after like gap of 1 year also. They are flaunting that 75,000 seats are being added. So it's a political gimmick. But without trained faculty pipeline or infrastructure, have they talked about what they have done for the infrastructure or faculty? So they are only talking about the number of seats. They are not talking about any other at the global level. Public patient, they have mixed feelings because more hospitals, more doctors visible right now, more residents are available. Quality of care and communication definitely suffers because those residents are not much supervised and safety concerns are definitely increasing. We know that patients are definitely not satisfied even after increasing PG seats. Now, this is interesting. In May, NMC has released this draft that next year onward we are going to have these 78 parameters, 11 criteria checklist of quality parameters will also be added in assessment of medical colleges. So all those who are happy with increase in PG seats and they think they are going to be accredited, they all will get the reversal of their seats because it's very difficult to be at par with these checklists. This is a very stringent checklist taking care of the WFME standards. So it's very likely that many of our colleges will lose the accreditation next year, many of the private as well as government also. So I'm not against the seat inflation, but seat inflation without quality is a self-sabotage. We need to have a moratorium immediately on new seats until new faculty and infrastructure ratios stabilizes. Strengthen what we have already, recruit and train our teachers, improve infrastructure, standardize our assessments and ensure transparency. Whatever we all have on the paper, we should really implement that first and then only we should expand again responsibly and sustainably. Thank you. Just a quote, in the race for numbers, let us not lose sight for purpose. India doesn't need more degrees, it needs better doctors. Every seat should represent not just an approval letter, but a promise of competent, ethical and compassionate care. Let us aim for quality first and quantity will follow naturally. Thank you.
So, wonderful presentation by both the speaker and both speakers put their argument with very interesting evidence and facts. And let me add few healthcare system of India. And let me add the report of Parliament Standing Committee recently, and they have flagged severe deficiency of healthcare system, especially the lack of specialists at the district level. And they have recommended the expansion of medical college and the MD seat or the postgraduate seat to increase the specialists at the district level. And another point Dr. Purva very nicely highlighted is it's all about the opportunity of Indian medical graduates and the postgraduate seat. On the contrary to US, UK or the Germany like countries, there are a proper balance and they provide a proper way and I must say that replacement. So definitely our Indian medical graduates are having less opportunity for post-graduation. But however, I would definitely say Dr. Priyanka also very rightly mentioned her argument that she talked about the quality of teaching and the quality of care. So quality of care will be improved by increasing the resources, the teaching material, not by reducing or stopping the PG seats. So rather we should focus on increasing the teaching material. Then secondly, very well she has pointed out about the political effects and the rising fees of private medical colleges. Yes, exactly. I would like to share here the CBI report recently in 2025. They have busted the connection and the network of ministry officials, NMC and private medical college representative, and they have charged lot of charge of criminal manipulation as well as the corruption also. So like increasing or the expansion of seats and the expansion of medical colleges is working like a culture media for corruption. But again, it's not the solution to stop the PG seat. Rather, stopping or removing the expansion of PG seat, we should or the government should take care of controlling the corruption. So, lastly, I would like to say that every coin has two sides, and in my opinion, as a teacher, as a physician, as a pediatrician, we should not have a short-term goal of just producing the postgraduate, but we have the long-term goal. We should think about the healthcare system of the India. So definitely, healthcare system of India will be supported by the specialists. So I want to congratulate both of the speakers for wonderful talk and the provoking issues, and both did their job very well. Congratulations both.
MBBS or UG is preparing for NEET. There we said that there are many other avenues, like they can go for police administration, they can go for UPSC. Why we are losing our doctors? Let the doctor be the doctor. MBBS student doctor ही रहे और डॉक्टर बन के एक स्पेशलिस्ट बनेगा, तो that will help the country and also help our children better. The population also. We have lot. Our population is so much that once the children they want to become a doctor. The doctor alone is not MBBS doctor. It needs to be a specialist.
USA, there are 30,000 MBBS and 38,000 MBBS post-graduates. They are more than the undergraduates. Competition is increasing.
I also pass a comment that the government should ensure at least 1 lakh rupee salary for every PG seat. And then they say, you develop a niche for yourself. So, how many can develop niche for themselves? Most are average students.
Government and private medical colleges भी खोल दिए ना, they are going in private medical colleges.
और DMV और ND और आपको मालूम है इस समय है I must congratulate you for very good arguments. But इस समय जो population to doctor ratio है वो WHO के recommendation से ज़्यादा हो चुका है already हो चुका है.
हमारी कंट्री का देखिएगा कि वो जो डॉक्टर पेशेंट रेशियो है वो कितना ज़्यादा स्टैंडर्ड है. कहीं पे 2330 है तो कहीं पे 1:499.
अभी आप दिल्ली का देखिए 550 है अभी, और बढ़ा देंगे तो वो भी दिल्ली एनसीआर में ही जाएंगे. उन्हें जाना मुंबई, दिल्ली, कलकत्ता ही है.
Yes, this is also a problem. I agree to it.
एक टाइम पे 1:1 का रेशियो हो जाएगा.
They will concentrate in the cities. They will be there in the cities. So if we see only of Delhi, if we see only of Gwalior, वो बहुत ही अच्छा होगा. Even आप ग्वालियर में देख लो 1:1 ना हो जाएगा. होगा तो जरूर दे दूँगी मैं से.
Congratulations to both the speakers.